Preparedness. Remember, this response will be essential to the health security measure. You do know what happened back in 2020 where we reported our first cases of COVID-19, where the Ministry of Health, in conjunction with the government itself, had to realign and reallocate some of their budgets of various institutions so that it can suffice to deal with this particular issue. Now, with me in this for the next 30 minutes or so for this first session will be Mr. Njuguna, Peter Njuguna Karanja. He is NOPE M&E Programs Manager. Mr. Njuguna, welcome.
Thank you.
And of course, joining Mr. Njuguna will be none other than Senator Tabitha Mutinda. She is the Vice Chairperson of the Senate Finance Committee. Welcome, Vice Chair.
Thank you.
And of course, this ties into the conversation. Let me start with you, Mr. Njuguna. Yes. Why now are we thinking of coming up with a budgeting for the health and epidemic preparedness? Was this not in place already?
You know, since COVID happened to us, we have never really looked back in terms of how we prepare our budgets in terms of response, in terms of detecting diseases, in terms of even preventing those diseases. And therefore, our call and our need for this is so that before the next pandemic happens, before the next epidemic happens, then we need to be always prepared. And a good example I'll tell you is when COVID showed up, nobody had a clue of what to do. Our supplies, our stores, our value chains, everything that we had did not look like it was prepared. And this starts with the budgeting. Yes.
And let me go to the Senator. Senator, you remember what happened, especially within the devolved units. They were required to come up with almost 300 beds for the ICU centers, and they were saying that there is no budgeting, there is no enough resources. They had to reallocate some of the crucial budgets they had planned for, like building of roads, hospitals and schools, such things, so that they can finance this epidemic preparedness. So will this be vital as a Senator?
Let me start by saying that COVID-19 was a wake-up call for not only us as a country, but the world. A lot was learned from, and definitely, like in good leadership pertains, the least is to, keep on doing things the same way, and then, of course, the results would be the same.
Yeah. Things
have to be done differently. And what happened having happened, and having us as Kenyans having learned critically the hard times and everything, of course budgeting is very important, very important. This ranges even from us as individuals across to the government level, because that moment was a moment that, of course, will go down in history as one of the dark moments in this country and the world. So when it comes to budgeting, in counties have a provision under the PFM Act to be able to set aside funds for emergency, 5% funds for emergency. And I'm not only the Vice Chair of Finance and Budget in Senate, but I'm also a member of the Oversight Committee called the CPIC Committee, that then we come and oversight these funds. Truth be told, that there are some counties that have not adhered to the mandate of what we call an emergency fund. Some of these funds have been really misused. This committee is a new committee, and it's actually been looking into the previous financial years from 2019, 2020, 2021, and we've been able to see, and we have a lot of audit reports that we've seeked for forensic audit, because funds were not utilized as purposed. Especially when we talk about emergency, because then what is an emergency? In a layman language, it's what is unforeseen, but it's set, and I can tell you all 47 counties, they have that particular provision, and I mean, all of them, they have that particular fund that has been set aside. The key question is, how is the utilization of that fund? Is it utilized correctly? Up to the national government level, the fund is there. But then how do we spend that particular fund? So that's where the concern is, but the fund is actually in place. Yes.
Okay, Njuguna, you can hear the funds are already in place. What is missing? Yes. The Senator is talking about utilization. Yes. Is there an act to guide not just the county governments, but the national governments as well, so that they can spend these monies prudently?
In agreement with her sentiments, I agree that the PFM Act provides for emergencies, especially at the county level, and it gives step-by-step on how to approach that, including how to access those funds. And I'll give you a very good example, is that in the close of the year, we had an emergency in a place called Londiani, where we'd lost quite a number of lives. The Londiani Level 4 Hospital, for it to respond to that emergency, for the county itself to respond, it means they had to find the police, the fire, and the health system in place within a span of 5 hours. If you look at the process of accessing the funds, then it becomes very difficult to access these funds on real-time basis. What is missing is the option to access for funds almost at real time. Of course, we don't want to skip the procurement processes and the necessary processes, but the challenge is always, like, health emergencies sometimes become very difficult to respond to when it happens. Another example is that there was a rabies in several counties of this country, rabies challenges that we had. The veterinary medicine department had to get vaccines for to vaccinate the uninfected dogs. The police had to come in and shoot the dogs, and the Ministry of Health had to come and respond to the humans that had been infected by it. If you look at the mechanism of the PFM Act, Section 110, then it becomes very difficult to access those funds on real time as we are losing lives, as people are getting infected, as cows bite people. It is very difficult to just respond to that. So for us and the Utayari project, what we feel we should push for, and we should maybe look into the PFM Act, is either to look at the health emergencies as a unique case, and then provide for opportunities for immediate response or immediate surveillance, maybe to collect samples, to do lab, something that can be allowed for people to respond almost on real-time basis. Yes.
And of course, if you're just joining us, dear viewers, we're talking about the budgeting for the health and epidemic preparedness. And joining us for this particular conversation is none other than Senator Tabitha Mutinda, the Vice Chair of the Finance Committee of the Senate. And then also joining us is none other than Peter Njuguna Karanja, who is the NOPE M&E Programs Manager. This is a conversation which is timely, to say so, Senator. You even heard from the WHO, they were talking about COVID-19 is still with us. We need to prepare for it as a country, and given that you come from the August House, are there plans to ensure that this time around we have enough monies to ensure that we can contain this epidemic, if it reaches, God forbid, to the situation we had back in 2020?
Just to point out that at the counties, we have the acts. Through the county assembly, they've been able, each county has their own act that guide them as far as emergencies are concerned. The issue is not even so much in terms of having the funds available, because the funds are available, and that is as per guided by the act, that is in place. The challenge that we have, and I need to call a spade, the problem that we have is on the execution, is on the utilization of these particular funds. At times they're not used for what they need to be used for, and that's where the problem is. But in terms of the question of, are we prepared? Have we set, have funds been set? They have been set because the law requires that to be set. That is in place, that is okay. The only challenge at times you find is now the personnel that have been given the mandate to be able to ensure that they execute the functions of an emergency fund. Remember, in the Act, as per the counties, we have the board. You know, we have also committees that have been set within that particular emergency fund, and one of the requirements is what you just call the basic public participation, for them to conduct and get to verify, get to know how many people have been affected, what are the basic needs that are needed depending on the different pandemic issue, because different pandemic issues then require different solutions at different times. So public participation takes place to determine the different factors, of course with the help of experts, you know, and during these times I really want to appreciate Red Cross. They've really come so much aboard during emergency times and been able to offer their services, their expertise, and we've been able to have solutions. But the biggest challenge at times is the people who have been given the mandate to be able to ensure people get the help that they need at that particular time with the funds that have been set. Okay. If it's procurement issues, they need to be adhered to, and what needs to be bought should be able to benefit these particular people who have been genuinely affected by some of these issues. Okay,
Senator Njuguna, I'm coming to you in just a few. Now, our conversation this morning, if you're just joining us, we're focusing on the budgeting for the health and epidemic preparedness and the generally status of the health care itself. You do know that today it is day 20 of the strike of the healthcare workers who are currently meeting at Arafware grounds along Gong Road and will be taking there any moment from now. I want to go to Mr. Njuguna. Mr. Njuguna, now couple it with the current situation that we have. WHO has said that we still have COVID-19. We have new variants of it. Now we have a doctor strike in the country. Not just a doctor strike, but clinical officers have also started their strike on Monday. Is this recipe for chaos?
It's a very bad situation to be in, especially taking that medical field requires constant work to be done. For example, if you look at how they respond to small illnesses, emergencies, all those things that they respond to, nobody's attending to those. We've always had a challenge with the workforce, especially the medical doctors are always few. And right now, as we speak, about 4,000 are on strike. So you know the gap they have left. You see also the clinic officers, we have about, I don't know how many they are, but we have a bulk of them going to the streets. So it means we are in chaos, and it's not a very good situation to be in. And I pray that we can find a solution very fast.
Yes. Senator, given that this will be your first time talking on this particular issue itself here at KBC, we're talking about today's day 20. The Ministry of Health has tried to intervene. The whole of the government itself has tried to intervene, but it seems the impasse is still there.
Abdi, then you're so keen because if you've noted that it's my first time to talk about it, I mean, you're very observant, you're very keen. Yes, it actually is. And one of the quick questions should be, one, is this strike legal or illegal? Because the court has suspended this particular strike. And I want to agree with you, Mr. Njuguna, that, I mean, it's a very delicate situation because we need the services of medics to sustain a healthy nation, then a wealthy nation for that matter. And it is very sad because, of course, Kenyans are very much suffering. The question is, where is the problem and what are the issues? Where are we coming from? From what we've listened on both sides, you realize that there's been the issue of the CBA, which was first signed in 2017 at an election time. And then you could call that under pressure at that particular time when that CBA was signed. Then there's the issue of the interns. As we speak, 4,241.29 interns are actually ongoing with internship, and they're supposed to complete the internship by the month of June, that particular lot. And Abdil, I can tell you that the cost is about 4.12 billion for these particular interns. At the same time, through the same process, we have about 3,500 interns who are now in the process of now taking in again internship process. So, but the question is, these interns, they're not part of the union. They're not also employees of the county government, nor are they also employees of the national government. Actually, then where do you put them? But the medical training requires internship to take place. You look at the data and you realize that the amount that interns are paid is about 206,000, which is about $1,500. When you go to other countries, like I think like Uganda is about 300, Rwanda is about 500. I think there's also 450 in Tanzania or something. And you realize Kenya, the cost is very high. We have also interns, like interns, the legal team, legal counsel, they are paid about 80,000. So the issue is that this cost is very high, especially at this particular time that we are in, with the cost of living and the way the budgets are. The cost is very high. But what is key is the room for the national approach dialogue that we witnessed. I think it was there last week where hopes came in, the minister was on board, the leadership of the head of public service. There's also the leadership of the medics, the SG. They were all on this discussion. So the government has done a step. They've come in, they've enhanced negotiation, and there is no government that can move without discussions being put in place. Look at where we are coming from, even with NADCO report. There had to be discussion. There had to be people sitting down, not only minding about themselves, but also minding about the welfare of the Kenyans that then you say, as a leader, you purport to mind about them. If you really then mind about them, one, this strike should be called off. Then room for discussion on the exact issue. There's the CBA issue that is very critical. It can only be done when these parties sit down and agree. You have to disagree to agree. Otherwise then, Kenyans are suffering. It is not fair. Then it is not genuine. Because we've seen the office of the CS and as I've said, the hopes, they've come aboard. What they should be emphasizing is then how do we get to conclude? Again, the other issue when it comes to the issue of how much they need to be paid and all that, these are also labor issues. The Ministry of Labor should be should also be conjoined in this discussion to explain, because the Ministry of Health has put its policies in place. The interns have an opportunity to be able to undertake the internship program as required per their course of training and all that. But now the Ministry of Labor should be able to come in and also advise from where they sit. Because the critical issue that is really coming out is how much that the interns should be paid. You know, that's where the issue is. Not really something that is out of hand. It's just something that is sort of delaying. Because when you enter into a room of negotiation, you have to have an open mind. If you're fair in your leadership, if you're fair to offer the services to your people that you represent, then there has to be fairness. What do you want signed? You want the CBA signed. Then come on board and let there be negotiations that you meet at a point so that now this crisis can be completely put aside. We can't have systems whereby the medics at their level. I mean, it's always about strikes. The last people that you actually expect to go to the streets is our learned friends, the medics. It is in their right, Article 37. Yes, it's very clear. Actually, their demonstrations are normally very peaceful. That's fine. But now, away from that, you know, the best thing is to push your leadership to be able to still sit and come to a conclusion. Because then for how long? Because Mark you, health is devolved. And so the governors have said that they are paying the salaries. So they are earning salaries. So if they're earning salaries, let them offer services to the Kenyans. Select a few. You see how we did with NADCO. We selected a few of us in terms of the political leadership to be able to represent when we had Mandamano, and a few were able to sit, got timelines, and were able to address the issues that had been raised. Why can that leadership do the same? Bring in a few of their members and a few from the different stakeholders that need to make a decision, and let there be a timeline to be able to address just one or two issues.
Mr. Njuguna, we're talking about what the health practitioners have been saying, that medical interns are the backbone of the health sector, health system itself in the country, and couple it with the issue that we're currently having here, the budgeting itself of this health sector itself. The issue, is it budgeting, or is it the allocation of those monies for their intended purposes? Now, with that in mind, is time of the essence to ensure this crisis is solved before this critical issue that has been raised by WHO over the new COVID-19 variant reaches to that extent?
You know, you need to resolve these issues almost immediately, because if you look at the number of interns that are being covered by, that cover work, it's about 27% of all the interns in this country that support the health system. Mm-hmm. So in case of crisis, in case of an epidemic arising, it means that it is almost impossible to respond to that right now. And I agree with Senator that if we do not engage at this point, if we do not engage actively, even as people go to the streets, which is their right, we need to talk to each other almost constantly. Mm-hmm. If you look at the history of the strike, looking back in 2017, when they had about 100 days of strike, yes, that did not sink very well, because it was almost like a coercion into this. Mm-hmm. But if since 2017 we have not been able to resolve our issues, then it means that engagement has not been happening. And is what we call out the government and all the parties involved to just open up and agree to lose some steps and agree to gain some. Mm-hmm. When it comes to the variant of the COVID-19 that we are experiencing and already within us in the country, mm-hmm, even when you look at what the Ministry of Health has already done, there's nothing tangible that you can say they have done to respond to this, mm-hmm, before it becomes crisis. And our worry and belief is that if you prepare in budget and in whatever other form you do, then we'll be able to set up systems that can fight such a disaster. Mm-hmm. So ours is to call that this be resolved quickly. If there's need to rewrite the CBA, if it needs to be rewritten, or the engagement needs to take another angle, then it should. We should get people to work almost immediately, because the health system is feeling the weight of this strike. Mm-hmm. So my belief is that this is not the best time to have such a crisis. It's not the best time to have that variant of COVID. But I believe there is hope in this country, because since 2017 we've been solving some of these crises.
Yes.
Yes, yes.
And of course, if we're reaching the 30th minute mark, I want to take, first of all, the Senator's final remarks on this issue, and we head over to Mr. Njuguna. Let me start with you, Senator, on this doctor strike, as well as the budgeting for the health and epidemic preparedness. Your last remark on this issue.
Yeah, I want to say that the ministry is reviewing the internship policy so mm-hmm. that it can be able to align with the WHO recommendations. Mm-hmm. And also the COG, the ministry, and the KMPDU are also currently negotiating on the CBA. So I think what we are saying as leaders and also as Kenyans is that the leadership of KMPDU should just select a few of their leaders mm-hmm. to be able to sit with the leadership of COG and the ministry, so that they can be able to iron out and fasten the CBA, and also allow for an alignment of the interns' mm-hmm. remunerations and policies to align to the WHO, and also give timelines. There's nothing that, I mean, you wake up and everything just realigns. There had to be a reason why some of these changes took place. So it is in that regard that time needs to be sought, time mm-hmm. needs to be given. And this is a government of dialogue. This is a government of discussion, mm-hmm. so that you solve issues once and for all. Remember, we are coming from a point as a country, we used to have all the time teachers going on strike, you know, each and every, after a few months before schools reopen, strike. But from where we sit, agreements were done, and we don't see that. So this is something that should be long-term and close, looking at what, as a coalition, Kenya Kwanza, we have as far as the health issue is concerned. Look at where we're coming with the shift. So the benefit of all this is for that particular mwananchi. So it's not what we would want to see reoccurring, whereby people are not able to get services, mm-hmm. yet doctors are still being paid by the county government.
Okay. Mr. Njuguna, your final remarks on this?
Yes, is that, again, agreeing with the Senator, is that Kenya has come a long way in terms of enacting laws that are supporting strengthening health system, and especially epidemic preparedness. If you look at the National Public Health Institute, which was established last year, but one, is there to provide for how the country should be prepared. We are coming around for the budget making processes. So I also ask Senator when she goes to Parliament, when she sees issues around epidemic preparedness, and I know we'll also continue to engage with them, is that they should allow for more budgeting, especially allocating money for health. It is a very important sector. I know it's not the only important sector, but you begin with being alive before you go anywhere else, before you go to education, before you're being transported, and that's where. Lastly is that as a national organization of peer educators, we are committed to supporting the Ministry of Health and the country in supporting preparedness and response in these matters. And thank you so much for having me.
Thank you so much. That is Mr. Peter Njuguna Karanja. He is NOPE's M&E Programs Manager. We were talking about the budgeting of the health and epidemic preparedness and a little bit of status of the healthcare itself, coupled with the ongoing national strike of the doctors and clinical officers that has entered day 20, but for the clinical officers, it is the second day. We do know that they are meeting at the Arfware grounds along Gong Road, and once we get a hold of that particular feed, we'll be crossing over there live. And of course, we'll be keeping Senator here. We're going to talk about the NADCO report itself.